Good evening, everyone, and welcome. Thank you for joining us. I'm Claire, editor of Medical Chronicle, and I'm joined here by physiotherapist Alison Dendy for her presentation on empowering women in understanding compression therapy. This webinar is sponsored by Jobst, which is a brand of Essity. Thank you for joining this evening. I'm coming to you from Cape Town, and it's an absolutely beautiful evening here tonight. Here's some background information about Alison. She is a founding member of Lymphedema Association of South Africa. She has developed a special interest in the treatment of lymphostatic elephantitis. She actively works with Netcare Foundation to offer pro bono treatments to patients with lymphedema who cannot afford advanced medical care for their condition. In 2018, she qualified in a new technique of lymphedema management, fluoroscopy-guided manual lymph drainage. In 2019, Alison traveled to England to enhance her qualification in lymphatic mapping. Alison has since set up the first lymphatic mapping clinic available in Africa. She is actively mapping patients to determine the accurate diagnosis of their condition. She is a trainer for Lymphedema Training Academy Africa and in the education of more lymphedema therapists, and has the privilege in working with the BSN Medical and Essity Company. Here is some guidance for the webinar. If you don't know, tonight is not for CPD points. It's an informative and interesting product webinar. So please bear that in mind. If you have a bad connection, there is a box at the top of your screen that says reconnect. Please click this button if you have any issues. It'll bring you right back into the webinar. If you haven't done so and you can hear this but you can't see anything, you need to click the play button to start the webinar. I sometimes get questions about that. There will be a recording of this webinar available to watch. You'll receive the link via email an hour after the webinar has ended. So like I said, tonight is not for CPD points, it's a product webinar. I'm going to hand over to Alison shortly. While I get her presentation ready, please type Y for yes in the chat section if you would like to be added to Essity's attendance register for tonight. This is just for their own register. And please type any questions that you have for Alison in the Q&A only box, and we'll get to those after her presentation. So that's the tab next to the chat box that says Q&A only. Okay, I'm going to hand over to you, Alison.
Hi, good evening, everybody. So nice to see some familiar names coming up on this. It's very lovely to see some very special people. Hi, Robin. You'll hear about Robin through the presentation. So obviously, with being Women's Month, we've decided to put this webinar and to focus on women. So I'm going to start off and I'm going to kickstart my presentation. So basically, we are going to look at vascular conditions affecting women particularly. So the vascular market is absolutely enormous in South Africa. And as you can see by those figures, the venous disease is 6 times greater than HIV in South Africa. Now, that is absolutely amazing to think of those numbers. So peripheral vascular disease exceeds 50% of the population of sub-Saharan Africa. How many of us actually know how many patients are out there? We don't really know, and we haven't really even capped a small percentage of this market. And we think it's important that we, with Essity and the clinicians and everyone who's on this presentation, helps create relationships and starts to share knowledge to empower us all to raise awareness in the South African market. And I'm extremely excited of where the South African market can go to in future times, so that we actually can develop a well-oiled vascular machine in South Africa. So this is a teamwork that we have to do, and we all have to focus on that teamwork. Now, in the stats of vascular varicose veins, you can see that the estimated value of 2021 is 5.6 mil. Estimated in 2028 is 6.7 mil. But if you go down to the bottom of this slide, look how many are actually in compression garments. Only 37,000. That is scary to think how many people have been neglected and are not able to receive the gold standard of treatment that is available in South Africa. Going towards leg ulcers, you can see obviously the numbers of less. So if you get 90,000, but again, very much less than the ones who are actually in compression garments, only 2,600. And that's very sad, in my opinion, that we're not able to help more people. So tonight is all about capturing this market so that we're able to help more people and understand what our intentions are and what we can do for so many ailing people. Right, so going on to chronic venous disease, and there's a very controversial statement to start with. So venous and lymphatic system are mutually complementary and interdependent. Now, that's an oxymoron. So basically what we're saying is that the lymphatic system cannot live out without its friend, the venous system, and vice versa. So this goes on to the concept of the lymphatic system, and that's something that we need to actually think about. Now, the lymphatic system is a new word that's come up, and I'm sure many of you do know it. And this is where when I first qualified in lymphedema in 2004, I was taught that the venous and arterial end of the capillaries release fluid into interstitium, and 100% of that, or 70-80% of it, actually gets absorbed into the venous system, returned to the heart, and the residual then enters the lymphatic system and becomes lymph. We now know that's not true, that there's something called the glycocalyx layer. And that glycocalyx layer, little cilia that sit in the veins, which actually prevents the communication between the venous and the lymphatic system at that point. So only when that system breaks down and the cilia are broken through maybe atherosclerosis or immobility, does the communication occur. And if that communication occurs, the lymphatic system can get easily overloaded. So the lymphatic system can increase its ability to carry fluid 11 times. Once it's reached its 11-time maximum, the edema starts, but you then start to set your keep 3 system. So these systems are inseparable. So phlebolymphodema is basically a condition which combines cardiovascular insufficiency with lymphatic insufficiency. And often the major cause of this particular condition is DVTs. So a patient then comes into a doctor's rooms, and the first thing often they say to a doctor is, I feel heavy in their legs, discomfort, itching, cramps, pain, paresthesia. That is your first stage of being aware that even before the visualization of your spider veins or your varicose veins, do you have a condition of chronic venous insufficiency starting to come in? Not actually chronic venous disease yet. Only when the edema comes in, which means the lymphatic system is then becoming overloaded, then you actually develop a phlebolymphodema. So the conservative treatment for these conditions, and obviously we have got surgical treatments, but we're going to focus today on the conservative. So in our conservative management, our gold standard of conservative management is compression leg garments. Obviously, we have to be very careful and be very observant of the wounds and skin care because that can easily break down. But modern man likes a quick fix. And very often a quick fix would be, let's take a pill. And unfortunately, this is one condition that a pill will not cure. A pill cannot cure varicose veins. And there's no evidence in all the reading that we've done and all the latest studies that have been coming out that prescription or over-the-counter medication can cure this condition. So we have to focus on our conservative management, being our manual lymph drainage, deep congestive therapy, compression garments, bandaging, exercise therapy as our major treatment in conditions like this. We can then go on to a surgical treatment, but that is not what we're actually focusing on today. So the problems that will include, if you go onto the right-hand side, you'll see that diagram there. And this is the KEEP system of classification that I keep referring to. So you've got your C0 to your C6. You will see at the bottom that the number of people affected are greater number affected with the C0 than C6. but the vast majority of people that require treatment are from about C3 to C6. So C0 are the ones that are going into the doctor's room complaining of the heavy, itchy, painful legs. It's only in C1 where you actually see your spider veins that you actually then are visualizing the first sign of chronic venous disease. Then C2 is your varicose veins going up onto when you're actually having your overload of your lymphatic system where the edema comes in. And it's at that point of C3 where the edema comes in that the clinicians become really important, that the reduction of their leg is so important before a garment is actually put on. And that then is talking about your compression bandages, your manual lymph drainage, etc. So going up onto the level, C4 is your inverted champagne bottle where you actually got hemosiderin around the ankle joint and the gaiter region, going up into the calf, which is bulbous. Now I'm going to refer back to this area, so let's just think about that. If you have a very malformed limb, we have to be very careful in putting a garment. So I'm going to refer back to C4. Obviously, when going high, you get your C5 and C6, where our wound care sisters play a vital role to actually get the healing of those wounds and to work with the clinicians to find the correct solution to get compression on those legs. So there we've talked about your varicose veins and your spider veins. We've talked about your leg swelling and your leg pain, and where chronic venous insufficiency only starts at C3 up. And then the highest cause of all these conditions is post-DVT and ending up with a post-thrombotic syndrome. Leg ulcers are important, and we cannot forget the vascular malformations that can occur, and can occur from a very young age, so your Kibble-Trani-Weber syndrome. Right, now going on to how and why would we choose a class 2 or 3 compression to increase venous return and to stop ulcer recurrence. So I've done a lot of research into the latest papers, and a lot of the stuff I'm going to tell you comes back to from 2021 to 2022. So in a random control study where we had a seat 2 to 4, class 2 to 4, they put on a compression of 10 to 50 millimeters of mercury Ni-A or Saha, and there was a significant reduction in healing of increase in healing of wounds and reduction of recurrence and overall improvement of the condition. They found that a class 1 garment certainly did increase venous return. However, a class 2 was very much better. In the next study, in that study, they found that a class 3 and a class 2 had very similar outcomes. In this next study that was in 2022, they showed a class 2 garment in the elderly with chronic venous insufficiency and ulcers actually improved the reduction of 95% of ulcer recurrence over 12 months. And then again, another study showing the 95% reduction reoccurrence after 6 months in a class 3 garment. So therefore, your actual idea to use a class 2 to 3 compression garment is a given. So let's move on swiftly to DVTs. Right, if we look at the stats of DVTs in South Africa, you'll see that the numbers in 2021 is 220,000, and the numbers are actually being treated by compression garments is 24,000. So, taking that, the risk factors that are causing of DVTs, there obviously are inherited factors like factor V Leiden or prothrombal munification and elevated clotting factor levels or skin necrosis. You're also getting your cancer treatments, which is obviously, and your family history. Then you get your reduced blood flow due to surgeries or mobilization, or being sitting for a long period of time, for example, more than 4 hours on a flight seems to be a very high risk. Over 40 years, overweight and obese is obviously a given. Autoimmune diseases like lupus, vasculitis, or inflammatory bowel disease. Now, tobacco products, we always say, yes, of course, tobacco products increase the fat, but why? And that's because it increases the homocysteine level. And the homocysteine level actually causes damage to the lining of the vessels, which causes the blood clot to come in. Varicose veins, because they have slow movement of blood, and then COVID-19. Now, again, I'm sure many of you know that there's a massive inflammatory response in COVID-19, and that cytokine storm increases the risk of blood clotting. So, there is a 1 in 1,000 chance per year of a woman developing a DVT. That's enormous. And there's a 2 to 5% of a woman having a DVT in their lifetime. Now, that doesn't sound too high, but if you actually put that in perspective, the number of women, that's a huge numbers that are actually getting DVTs. And the reason is often is due to birth control. Now, obviously, birth control can come in a combination, pills, patch, etc. But the most of what they find a very high risk is when they do a combination birth control. And that triples your risk of developing a DVT, even though this overall risk is still quite low. It's not enormous, but it does triple. When you're expecting a baby, due to the change of hormones and the physical change in the body, there's a very high risk of developing a DVT. And strangely enough, 6 weeks afterwards is even higher, 20 times more higher, 6 weeks post-delivery. Obviously, estrogen therapy in older women, and they find that a skin patch in an older woman has a far lesser chance of developing DVTs. Now, there's also a tremendous controversy about whether we do put compression on post-DVT. And there can be a long-standing debate of whether it is necessary. Is it a good thing to do? Will it cause the clot to move? Should you, shouldn't you? And doctors can have many hours of debate about this. And in 2021, they did a very comprehensive study involving 41 countries. And that showed that 81.4% of those countries actually compress immediately. But this study came out with some interesting facts, like basically 91.7% of patients reducing pain and swelling. But what is actually really important is it changed the minds of a lot of countries. So 33.2% changed their protocols. So in other words, they were putting compression on earlier. Some of them took it off. Some started later. But it all changed the idea that it is generally accepted in the world that compression is important with a DVT. Now, do we do prophylactic compression? Is that a thing? And oh, yes, it is. So the study that came out showed about 1,681 participants that were undergoing surgery, being it orthopedic or general surgery, showed that only 9% of the patients that wore compression got DVT. 1% of them who did not wear compression did get DVT. So in another study, they showed a 63% reduction in the formation of DVTs. And in a very interesting comment that should you really wear compression? Well, there was a study that was done that after 4 hours of flying, to wear compression was really important to prevent DVTs and showed a very significant improvement in the formation of DVTs and pulmonary embolus. Now, the comment is, do you go BK, below knee, and do you go full leg? Now, that is another big debate that's come in. But if you think about the general consensus, if you're sitting for a very long time and you do go full length, you're not talking about someone who has lymphedema, who has their ordinary stocking that goes on. You would actually then put on, you would actually rather do a BK so that you're not actually affecting the popliteal fossa to cause reduction of flow. So it is a debate of what you actually need, but majority of the patients that are not showing symptoms, in other words, we're talking about prophylactic compression, a BK, a below knee compression garment is the right way to go. And they recommend the tightness of that compression garment in the prophylactic section should be 30 to 40. In other words, a class 3. And that is when the patient is mobile and you have no other contraindications. Remember, we're not talking contraindications here, and I'm hoping that we will all know when you don't actually put on compression. So let's go, something we don't talk about. You know, we're so busy as clinicians talking about quantities of sufficiency, DVTs, what we forget about our sportswomen. Now, compression is a thing in sports, and let's go through why. If you're going to put compression in women, if a woman has an injury, or for that matter, let's not ignore our poor men, they are out there. If these men or women have an injury, it causes internal bleeding of that soft tissue. Now, anytime that you put on compression, you will stop that bleeding of the soft tissue. The more the soft tissue bleeds, the more injury that actually occurs. So you want to stop the bleeding as quick as possible. So in all my patients that have a sports injury, I will put them in a compression garment as a given. It's the first thing that I do as they go into some form of compression. If you have too much inflammation and swelling post-injury or with post-exercise, that inflammation itself causes cell damage. That cell damage then releases substances like histamine that causes further cell damage. So therefore, the more you can reduce the inflammation and hold that inflammation, the better the outcome for the patient and the quicker the healing rate. There also talks a lot about enhancement of performance of athletes. Now, is that psychological or is it a thing? It's actually a thing. And what I mean by thing is it's real. It's not that they perceive that they're better. If you put compression on a joint, you're going to improve the proprioceptions by stimulating the Golgi tendon organs, etc., etc. So there is a very real need for compression or improvements in their actual performance by using that compression. If you decrease the possibility of injury, so if you are supporting the joint and supporting the flexibility and the functionality of flexion extension in the muscles, you're actually going to be able to improve the muscle function. And that will then improve and reduce the amount of injury that can occur. And therefore, if an injury does occur, improve the healing process. So why does compression work? So number one, if you put compression on a muscle, it increases the blood flow. Now, you immediately think, as if I'm going to compress a limb, I'm actually going to restrict the blood flow, but the exact opposite happens. So you actually put that compression, you're enhancing the functionality of the venous return, and therefore improving the fluid moving out and the fluid coming in. Now, anything that includes movement actually enhances the oxygen supply. The moment you have improved oxygen supply, you get better healing, you get better cellular and molecular function. With better compression, you get better neurotransmission. Again, we've talked about the proprioception, where you're improving the enhancement of the muscle functioning to improving the joint stability. And if you are putting compression on the muscles with flexion and tension torque at the end of the range, you're enhancing the muscle's functionality at the end of the range. You're improving the post-exercise and training. And then we talk about the psychological factors, which are real and important to acknowledge, that if you feel more secure in your limb, you are going to perform better. Okay. And the physical properties in the garment must be considered. Now, I'm going to say this. So we've got to think about air permeability, heat, moisture transmission, antibacterial properties, and tactile characteristics. Now, I'm going to go through, just remember what I've just said, the air permeability. And as we go through the actual type of stocking that we're going to use, I'm going to go and refer back to these things that a good stocking would be required in the sporting environment. So, why I personally would choose a class 2 compression for sport, but why in a woman? Now, we are talking women here. Pressure threshold for women athletes is between 44.1 and 73.5 millimeters of mercury. That is threshold. That's the maximum force that you can put through a calf that we're talking about to actually enhance that functioning, and that's the maximum amount a woman can tolerate. But the average capillary pressure is 32.3 millimeters of mercury near the surface of the skin. But the comfort pressure for women's athletes is between 14.7 and 29.4. Now, if you put all those factors together, it then makes an easy decision that we choose a garment between 20 and 30 millimeters of mercury. We don't want to take it too high. If we take it too high, we cause excessive discomfort. If we take it too low with insufficient pressure, we lose the efficiency of compression. And in the same vein, if we poorly fit that garment or use an improper garment, you're actually going to get adverse effects on the wearer. So do we go round knit like your Job's Relief that you see in the picture, or do you go a flat knit garment? Now, the choice of garments in all the studies that I've gone through in the latest research says a flat knit garment is your choice of garment. The only problem is with a flat knit garment, it comes with a seam at that, and that seam goes directly over the Achilles tendon. So with excessive extension of the ankle, for example, it will cause a rubbing effect. So even though it is considered a gold standard to use a flat knit garment, the way the flat knit garment is constructed, it wouldn't be a garment that I would certainly choose. And I would then go back into a round knit garment where it's smoother on the skin, it's more flexible. Yes, it can tourniquet, but with correct measurement through correct clinicians and correct fitting, it's the garment of choice. So, does compression work? Absolutely yes. And the latest study that was released in 2021 of 512 athletes. And now, are we talking about professional athletes here? We're not talking about you and I. I'm sure there's professional athletes here, but we're not talking about me, who goes out to the gym and pretends to exercise. These 88.1% of these endurance athletes, long distance endurance athletes, wore compression. That's incredibly high, but those figures are not translating into the general population. And on average, they wore that compression to prevent an injury. Okay, the only 14.5% were actually treating a current injury. 13.6 were to do post-injury recovery. And look at that, 0.2 was to look good. I love that. Anyway, so most of these athletes were calf and shins injuries or problems. That's where they got their compression. 90% of the athletes were convinced or could show that by wearing compression, they prevented further injury. Now, let's take a step back and talk about compression, we're talking calf. Let's now talk about your capri trousers, your compression trousers, and people exercising in compression. Abdominal compression is extremely different from compression within the calf. So if you're going to work abdominal compression on a softer abdomen, you're actually talking about only be able to put on 11 millimeters of mercury in an athlete. And a lot of these compression garments are 20 to 30. So if you're putting an incorrect fitting garment in a capri short look, you will actually cause a reverse flow of the vasculature and of the lymphatic system, causing swelling in the feet. So that is something we see as lymphedema therapists quite often if we are trying to play with certain types of garments. But going a little bit off the topic, and this is something I see so often, patients, ladies particularly, who are coming into me who are concerned about the abdominal area and are using very tight compression that they can buy off the shelf at Woolworths or wherever to add so that they can form a better shape around the abdominal area and gluteal area and inguinal area. Then they come to me with lower leg swelling. And when you are doing a lymphroscopy or lymphatic mapping, as I call it, you can actually see that the fluid of the lymphatic fluid goes up to where the garment starts, and that garment itself is actually restricting the flow. So it's really important. This is called the butterfly moment. It's really important that we consider that compression has got to be graduated. And when compression is graduated, it's got to go tighter at the bottom and looser at the top. And a lot of these garments are not working in that direction. It's called a butterfly moment. Right, so compression for balance. So we were talking about proprioception and where compression goes in imbalance. Now, it was shown, a study showed a significant improvement of balance, a 5% improvement, which is quite significant with the eyes closed, with a well-fitting garment in the calves and ankles, and also around the shorts, in a short fashion, in the shorts. But there was a significant difference. It had to be a well-fitting garment and not a loose-fitting garment for these patterns to be observed. But in women, we find it's very important to look good. And this is something that we need to consider in the compression sector, is that the garment must have functionality and style and to satisfy the levels of a female athlete. And I do feel that that needs work. It's an area that we do need to work on. Right, let's go into pregnancy and compression. Right, so there we go. All right, so a pregnant woman or postpartum are at increased risk for DVT. Now, the increase is 20 times after the birth of the child. Postpartum increases 20 times for up to the first 6 weeks. In general, the amount of blood clots increase 4 to 5 times. And 80% of pregnant women experience feet swelling in the third trimester. So the reason is, obviously, we know that the blood volume expands. So if there's more blood, there's going to be more fluid produced. But also there's pressure of the uterus over the pelvic veins. So that pressure of the uterus actually causes restriction in the inguinal region. And with that restriction, it causes the fluid not to be able to return, and you get a build-up fluid in the legs. And if there is that pressure of the uterus over the pelvic area, if there is decrease in venous return, obviously there's more fluid that can be pushed into the extracellular space. So why compression during pregnancy? So reduce feels. So if you look on the right-hand side, you see the very soft edema that is far worse at night. That edema, because it's so quick to come on, is actually really painful. So you find that on this morning in a pain like that fluid is reduced, and there's a lot less discomfort in the ankles and feet during pregnancy. It also supports the cardiovascular system by forcing the blood to return to the heart. It reduces the diameter of the blood vessels, okay, and therefore you don't get as much pooling of blood in the blood vessels, and therefore reduces the formation of blood clots. It also helps prevent varicose veins. And if you talk a lot of your patients, a lot of them will report that their varicose veins started during their pregnancies. So in other words, they then started to go into your keep 2 to keep 3, keep 2 level of actually starting to have cardiovascular disease. So we said that blood clots increase 4 to 5 times in women that are pregnant. And the very important is they report that they're able to maintain the shape of their legs. So therefore had a more normal shape and less elephant legs. Excuse the word, but it's really important that a woman who's pregnant does feel better and look better, because a lot of the time your self-esteem is taken a knock. Then it obviously alters blood flow. We've talked about that. And it supports your varicose veins and your spider veins. Now, a lot of my lymph patients, my women coming in that I see that come in for mapping or for treatment, actually report, if you ask them, when did your swelling first start? And they say it first started during pregnancy and never went away. So that is when they actually then went into a CEP3 and it never reverted. So they then became a lymphedema. And that is something that if we can prevent those patients having that tendency to becoming a lymphedema patient, that would be really great. Because as we all know, lymphedema is quite a difficult condition to live with. Okay, so when do you wear compression during pregnancy? So varicose veins appear around the 4th month. And 6 to 10 women, 6 out of every 10 women discover varicose veins during their pregnancy. That is high, and they don't go away. And the varicose veins, as I said, is the 4th month. So when do you start wearing compression? Generally in the 1st trimester, before you have started to swell. But obviously, you will increase in swelling in your 2nd and 3rd trimester. So you need to wear the socks as long as they are comfortable. So generally, they're going first thing in the morning and come off at night, and not slept in at night. So generally, 20 to 30 millimeters mercury is sufficient in the 2nd trimester, and then going, and that should be, say, first 2 seconds, yes it does, and 30 to 40 millimeters in the 2nd to 3rd trimester. And then they should be continued to be worn up to 6 weeks postpartum. So compression reduces the swelling and leg pain during pregnancy. And that we're talking about the graduated compression. So graduated compression relieves cardiovascular disease during pregnancy and postpartum. And in a study of women that were pregnant 4 to 28 weeks of pregnancy with a CEP3 to 0 to 3, reported a great improvement in quality of life and reduction of leg pain when they started using stockings. Another study in 2022 was 60 pregnant women, 30 of which were putting a class 2 compression and 30 without. The ones wearing the compression reported a far lesser amount of leg pain, and they found that they would wear them again. They were so sufficiently satisfied with the function of the garment, and they were not uncomfortable and would definitely wear them in a 2nd pregnancy. Another study of another group of women doing duplex ultrasound of the great and the smaller saphenous veins with compression showed a reduction in the diameter of the veins. And that is very important in terms of prevention of varicose veins. So if you are compressing that vein, you're not going to allow it to form a varicose vein. Now, what's very interesting, I found a study that was conducted in 2017, and that showed the application of a class 1 to class 2 compression garment during the 1st trimester of pregnancy showed a significant improvement of nausea, vomiting, and dizziness. And that is because it controls the increase in blood volume position. So where's the blood volume? And it actually then improves the blood pressure, improves the overall health of the patient. And that seemed to improve the nausea and vomiting. I found that very interesting. Right, choices. What garments do we choose? Right, so compression, Jope's compression, I do believe is the premium choice. And I think a lot of people are with me that use it on a daily basis. So it's a graduated compression. It's improvement of venous and lymphatic return. The graduate compression increases the tissue pressure and improves the capillary flow. It helps reduce the swelling. It counteracts the hydrostatic pressure, and it is measured in millimeters of mercury. Those are your basic functions. So basically, it improves the venous return, and so it doesn't allow for the lymphedema to actually, or the fluid to accumulate. There are two types of garments. You get your circular knit or your flat knit. So going on your circular knit, you'll see that we have the ultra sheer, the relief, the opaque, and the ulcer care. Those are the main garments that we see. The new garment that you have there is the opaque, which I'm very excited about. And it has just been released in South Africa. So circular knit is produced in a tube. It has a set number of needles, so its variation in size is reduced. It cannot vary that much. It has a high working pressure and a high resting pressure, which means it's a long stretch garment, which means you cannot wear it at night. It's a thinner garment, which is more cosmetically appealing, but it has a tendency to curl. So it is terribly important that the clinician measures this garment accurately. If you measure it too tight at the proximal end of the stocking, it will result in a curling of that. So it's very important, particularly when you have a malformation of shape, that you take extra care in measuring of that garment. So I'm talking in your inverted wine bottle effect. That's where your calf, your ankle circumference is much smaller in relation to your calf circumference. There you need to sit back, and if you don't know what garment to put on, you need to ask your SAT or BL rep to know exactly what to do. And there's a lot of advice out there that you can. The most important thing to realize with a circular knit garment is that there is a flexibility in the diameter of up to 5 centimeters. So if you're measuring, for example, 28 centimeters, it can expand plus 5 centimeters. So if you have a mobile edema or a lymphedema, it will expand to the point of stopping, in other words, increasing by up to 5 centimeters and therefore not contain it at the measurements that you have done. So your choice of a round knit or circular knit garment is really very important depending on the type of edema that you're actually dealing with. The circular knit garment can be off the shelf or custom made. In your flat knit garment, that knitted is a flat piece of fabric that is stitched together at the back of the leg. It's a short stretch garment and very commonly used to treat lymphedema and lipedema. But the reason we use it is it has a tendency to hold its own. So it can bridge skin folds and it is less likely to tourniquet. So in your more mobile edemas, it will hold its own without forming any tourniquet or folding. It can be, a total number of needles can be increased and decreased, and it can be knitted according to variations of shape and width. It is an off-the-shelf garment, it is coarser, it is thicker, it's less visually attractive, but it is actually very comfortable to wear. And a lot of my patients, my lymphedema particularly patients, say that they are more comfortable in a flat knit garment and it's easier to put on than it is a round knit garment. Let's go on to what we can offer. The Jokes Ultra Sheer. Now, this is a premium range garment. It's a medical grade graduated compression. It's cosmetically appealing. Its colors in a natural. It can be knee-high, thigh-high, or pantyhose. They are not used in sport. Now, this is where you go back. The reason is they are breathable, but they're not heavy wearing. So they can ladder. They're a prettier stocking to wear, and particularly for women where this is very important to actually feel good and to maintain your self-esteem in sometimes very difficult circumstances. This is very important for certain women to actually feel good. They're used for everyday use, but the material, as I said, is not robust and needs to be handled with care. It's more comfortable, it's more breathable, it's lightweight, it's a sheer and finer yarn. It can be unisex, but it has a frilly band at the top, which is awfully cute. We have to get our men around that. They have to embrace their femininity if they want to wear it. But it is really, really pretty band. And it can be used for lower grade keep. So in other words, your keep 1 or 2 classifications. This is a garment that can be used for that. You can get it in a class 1, 2, or 3 garment. So then we go for the Jopes Relief. Now this is when I was practicing. This was my go-to garment. It's reasonably priced, it's durable, it has a strong fabric. It is not as cosmetically appealing, but it is very cost effective. It is unisex. And this is a garment, and I say this carefully because this is a garment I would choose for sport. Now I say that carefully because recently with the release of this exciting opaque, which we'll go to now, and I'll go through it, is why I think that might be a really good garment to choose in the sporting field. But this is a very good post-recovery garment. It's a very good vascular garment. It is used for keep 1, 2, 3 when it is reduced. It's very much a vascular garment, and it's your go-to choice. There is another garment out there, Jopes, for men. Obviously, our poor men are being left out today. But if my women are okay that they can scratch out the side for men on the box, that is a very good garment for sport. The class 2 can come in a black, knee-high and thigh-high, and the rest are available in a beige. So a lot of my lipedema patients I would put in relief, so long as they were not too high a grade in lipedema, and they're very comfortable in this. And I would then choose a 20 to 30 millimeters mercury, a class 2, as a standard approach for something like that. But when you are dealing with a much stronger and higher grade, you have to increase of injury or disease, you have to increase the grade of compression to a class 3. But as I said to you in the beginning, this is my garment of choice when it comes to your everyday use for your vascular patients. Now, this is where I was alluding to my exciting news. And this is the Jopes Opaque, which I think is a wonderful product that I was so pleased that Essity and Jopes have released into South Africa. It's only available to clinicians, from clinicians, so you can only order it through the clinicians. It is a very comfortable wear. Now, what's so exciting about this is it's a combination between the ultra sheer feel and the functionality of the relief garment. That means it's very breathable. It is a high, less likely to ladder, so it is definitely more durable. And what is exciting me is it has a high performance moisture management, which means that the fibers can actually force the fluid out to the surface, which then can be evaporated. So you put that into South African heat, and it's a very nice feature that we need to actually look at. So also, if you are in a sporting environment and you're able to disperse that moisture and to the surface to be evaporated, it's going to be a very nice garment to use. It's a fine opacity, so it's finely opaque, and the knit structure is quite discreet to cover small imperfections. It's a special yarn which is soft and very comfortable to use. So it's a very high quality garment, which has a durable reinforced heel and toe zones, which is designed for long-lasting compression. Now, all those lovely features, it obviously is a little bit more expensive, but it has been very well received in the UK, and the market in the UK is growing rapidly, which I'm actually expecting to happen in South Africa as well. Right, let's now go for our maternity range. So in our maternity range, we have a very nice garment that's come onto the market. It's also opaque. And women obviously require the garment needs to be comfortable. It mustn't limit their daily life. It must prevent permanent vascular damage, reduce the pain in the legs, and release the stress on the body, including the belly and the legs. Now, 45 to 75% of pregnant women experience low back pain. Now, the belly section, the back section of this garment actually helps support that lumbar area and support the belly, which means it helps reduce the actual pain in the back that many women do end up going to physios for to treat that and the sciatica. So this is a very nice feature that we see. It is more flexible garment, so it's easier to don and doff. And the elastic belly section is soft, fit, adapted zone for the growing belly. So it doesn't restrict the growth in any way of that belly, but it protects the belly's sensitive area. And of course, it does also have the moisture, ability to keep the moisture away, and it has special knitted ventilation zones, which are very, very, very important in South Africa and in pregnant women. So let's go through a very interesting fact that the Jobst Opaque has. The Jobst Opaque has a Jobst sensitive. Now, this is a patented product that is available in the silicone yarn, which is woven into the belt section of the garments. So it's in the thigh-high garment, and the silicone band means that the fabric is woven in with silicone. So it's not coated on top, but it's woven in. So it has a soft grip on the skin. There is a sensation of pressure, but there's no visible skin imprints that we see on all of the other garments. So it stays up without the skin irritability and the red marks. And of course, with there's no actual silicone directly in contact with the skin, it actually then prevents less sweating underneath and causing a welt under that area. And with that, prevents very little skin infection or maceration caused by maceration. So this is a wonderful product that we are finding, and it's a very useful product to use that we have the opportunity to have available to us, particularly on the patients that have got the sensitivity in the skin. So where can you buy our range? Right, so we have major suppliers. We've got BL Medical, High Tech Therapy, and Dis-Chem Home Care. Now, the BL Medical is where the clinicians can order from. They are, the clinician would then measure the patient, send through on email the correct garment size, and all the information is on the slide there. And if you have any queries and you're not sure of exactly what to do, it's really important to contact your BL Medical rep or your SAT rep. But BL have a secret weapon. Their secret weapon is called Robin. And she has got me out to many of a sticky decision making. Her knowledge is absolutely amazing. And if you are really in a difficult situation, give her a call. You will learn the most incredible things about the products. So you'll see that BL Medical has the maternity opaque range. It has the opaque range itself, the relief, the ultra sheer, and the ulcer care. Now I'm going to stop here for a second because High Tech Therapy also has the ulcer care, and we'll get on to High Tech Therapy now. But let's work with both of these. The High Tech Therapy and BL Medical have Jobst ulcer care. Now, Jobst ulcer care I haven't spent much time on, but it is a wonderful product. When you have a sensitive skin, it's a two-layered product, which you have your inner liner and your outside compression. So it goes up to 30 to 40 millimeters of mercury with the two compressions. And it is a very good product when there is a wound. So this is all for the wound care sisters. If you have a wound there, that inner liner can be exchanged and there are a number that come in the pack. I think there are 2 that come in the pack. But that inner liner can be exchanged, and this is a hang of a good product. That if you do not want to bandage the patient, you want the patient in compression without bandaging, this is a very good product to choose. And this is my go-to product for a lot of my elderly patients because they find it a lot easier to get it on when they need compression. The added benefit of the inner liner is that can be washed and you can buy more inner liners. And the outer liner seems to stay fresher and last longer. So to replace the inner liners is not a huge expense. So it's very, very user-friendly, particularly with the elderly patients. Now let's get on to high-tech therapy. High-tech therapy, the process of ordering is the clinician will script, and notice the word script. Script. It's really important that a script is sent through to all these suppliers because they need to know exactly what they need to do. There's no point in putting a telephone call through. You do not know, you might have made a mistake. The moment you put pen to paper and type it up and send it on email, you can actually visualize exactly what you want. And just a heads up, when I actually send in for a garment, particularly to BL Medical, I actually don't only choose the garment, but I will write the measurements down. So if for some reason the supplier, BL Medical, has a look at what you asked for and they look at your measurements, they might phone you and say, look, are you sure? Because actually you might fit better into and help you make a decision, which is better for the patient. High-tech therapy, the clinician will measure the patient. They then script the measurement through to high-tech therapy, and the high-tech therapy then supplies the correct garment. Now, high-tech therapy has an app, which I'm sure you can get hold of quite easily. And you then put your order through on that app. It is incredibly efficient, and their delivery is really quick if they have stock. Dischem, this is a new avenue of sales for Essity. Dischem, the products are not on the shelf, so the patient can't walk in and say, oh, I want that one, and they take it, and it might be an incorrect fit. So the clinician scripts the request with the measurements. The measurements are done by the clinician, and then the script is emailed through to Dischem Home Care. Or the patient is referred by the GP through to Dischem, the qualified sister who's trained in measurement, trains the garment, measures the patient, and then decides on the correct garment to actually fit the patient. They are trained in this. So they have yes, it is a small range, but they are able to help the patients then and there. The garments are now also available at places like Farm, which has started to stock the products, which is very useful. So the product is quite easy to get to now. Right. How's our timing, Claire? Can I carry on a little bit?
Hi, we do have some questions, but it's up to you. If the audience would like to continue watching, please do. Otherwise, you're welcome to wait till after this for the Q&A session.
Okay, so guys, are you happy to continue? I would just like a little bit on lipedema. Okay, so lipedema cannot be managed. It cannot be cured. It can only be managed. And this is a pet love for me. I'm afraid lipedema, I feel desperately sorry for these patients. It's a chronic metabolic disorder of adipose tissue. Bilateral symmetrical, 11% of women worldwide have lipedema. Obviously, its onset is at hormonal changes, puberty, menopause, pregnancy. It's hereditary. It does often have an underlying obesity factor, but I will show you later that it is not obesity. And lipedema can, with obesity, induce lymphedema. And the gold standard of treatment is a flat-knit garment. So if you see the various various types of lymphedema, when I first qualified lipedema, I saw I was told that the upper body was thin and it was only the lower body. But as you can see, the first one is the buttocks, then buttocks and thighs, buttocks, thighs, hips and calves, arms included in the buttocks, thighs, and then only lower leg. All of them do not have feet involved. And that is a very important factor in considering whether you have a lipedema if you don't have fluoroscopy-guided lymphatic mapping. But you can see the feet are often never involved. So the dorsum of the foot is not bulbous. So your stages of lipedema, you can see there, 1 to 4. And these are patients that are actually, with permission, are my patients that I have treated over a period of time. And then you can see the various stages, what it actually physically looks like. Right, so the choice of treatment is liposuction, decongestive therapy. Now, they talk about, in my opinion, obviously decongestive therapy would be a very nice way to go. And the problem is, liposuction is considered a very important form of treatment. It's considered a more longer-term treatment option. However, our problem in South Africa is the medical aids are very loath to pay for anything. They're very loath to pay for this particular treatment, which is very sad. But if we were to choose either one of them, neither one of them are curative. So liposuction can either be water-assisted or pump-assisted liposuction. But before any liposuction is done, necessary treatment must occur. And now the first thing is the patient needs to have at least 2 sets of garments before treatment occurs. Now, there is a controversial, do you bandage lipedema or do you not bandage lipedema? If lipedema is combined with lymphedema, by all means put on compression in the terms of bandaging. But all lipedemas should be in compression garments. Now, the higher the compression garment doesn't give you a better result. The better compression garments are actually lower compression, your class 2s. I found a class 1 tourniquet very easily. Obviously, your flat knit garment is your gold standard. They're easier to get on and they go over the folds that easily form when there is a lipedema patient. It's really important that before surgery, the patient is treated adequately and advised that even if liposuction does occur, or they get permission to do it or have the privilege of being able to afford liposuction, their treatment is continuously afterwards. They will always be in compression. So compression has to be their friend. So that compression is used pre and post-surgical to prevent rebound. So, learning about lipedema, these are the latest facts. They have found that all lipedema have a protein molecule, PF4 protein, that is found in the fluid of a lipedema patient. The same protein is found in the fluid of a lymphedema patient as well, but it is not found in an obesity patient. So if they're going to do liposuction and they collect and test the fluid, and they do liposuction on a patient around the abdominal area, and then do liposuction on the leg, they will find the presence of the protein is only on the portion of fluid that came off the leg as opposed to the abdominal area. And that is a very strong distinction between whether it is lymphedema, lipedema, or obesity. So our hypothesis is that the lymphatic defects change the ability for the subcutaneous fat to clear the fluids from the tissues, which results in swelling, inflammation, and abnormal growth. So basically what happens, the cells can only store the fat. They only get to a stage where they can only store fat, and they cannot release it. So they don't respond to any form of dieting. And what's very interesting is a lot of my very big lipedema patients come in malnourished. with a very poor protein concentration because they're so busy dieting that they actually are physically malnourished. So if their protein levels are very low, they will also then develop more lymphedema, obviously because it's a protein-rich fluid. So it is very important that these patients are educated in a correct diet, that they have to come to terms with the fact that this is a condition that is not related directly to obesity. It can result in obesity, and obesity can be very strongly related to it. But no amount of dieting will change their condition. I've had a patient that was advised to do bariatric surgery who was a well-defined or well-recognized lipedema patient. And with the bariatric surgery, what happened is the upper body became emaciated. And all that fat that was taken off the upper body, the body distributed it into the lower body, and they became bigger in the lower body. And it was a very sad scenario because they became very dysfunctional. Estrogen plays a very strong relationship into lipedema, and therefore we see it often at the onset of puberty. And there are a lot of studies going on at the moment in the medical fraternity to find out whether a change in estrogen levels can change the actual size or type of lipedema that is present, or the deterioration of the lipedema. So let's go a little bit on to cancer-related lymphedema. So quick facts about lymphedema. So 150 million people worldwide have secondary lymphedema. 150 million. Gosh, that's scary. And obviously we all know what it comes from: surgery, radiation, types of cancers. Infections are also very high in causes of lymphedema. Obesity is a huge problem, and it's a growing problem in South Africa that's creating lymphedema. And then obviously you get your primary lymphedemas, which we're not actually going into today. Lymphedema cannot be cured. It can be adequately taken care of with decent advice, manual lymph drainage, compression therapy in both bandages and in garments. And the patients can live a perfectly healthy, normal life. The most important thing is early identification of lymphedema to allow for effective treatment. So what you have to watch out for is a feeling of fullness, heaviness, tightness of the arm, chest and armpit area and breast area. And when they report that their bra they don't feel quite as good, these are stages where you're not actually visualizing that the lymphedema is present. Now, with fluoroscopy, we can take these patients and actually map them and see very, very early on of where the problem actually is before they have visible swelling. And that is something that I find very exciting, and something that we're trying to get more and more accepted into the country, so that we're able to map these patients before there is actually a problem. They are aching, new pain, weakness in the arm, trouble bending or moving a joint. That's obviously when it starts to get bigger, swelling of the hand, and thickening and changing of the skin. So, secondary lymphedema, your breast cancer, your ovarian cancers, uterine cancers, cervical cancers. The prevalence of lower limb lymphedema in uterine, ovarian, and cervical cancers are absolutely enormous. We have so much time concentrating on your breast cancer that we seem to have lost the focus on other cancers like your ovarian, your cervical, and your uterine cancers. In the picture on the far right-hand side, you will see a patient standing there with their one leg, and you'll see drawings on that leg. This is a patient that I've met. In the bottom part of the leg, you'll see that those are lymphatic collectors going up the leg. And then you see that the lymphatic collector diverts, and you can see it's not a very clear picture, but there's lots of dots and stripes on that leg, and that is all dermal backflow that has occurred because of the blockages in the inguinal region. So obviously we know the treatment, your manual lymph drainage, your bandaging, and then of course in the recuperative phase, important, the garments. Gold standard of garments for lymphedema is a flat knit garment. Now in the picture here of this axilla, you will see that there are long strings that you can do. Now we all know that as axillary web syndrome. And what axillary web syndrome is caused from is that when they remove the node, sentinel node, for example, the lymphatic collector that goes to the sentinel node continues draining fluid to that area, but it can't go anywhere. And what happens is the water is released out of the lymphatic collector, and the protein is left behind. And that protein then organizes itself to form that axillary web syndrome, or what we call cording. Now, compression on that cording is absolutely vital, because if you can break down that protein, you will break down that cord. Now, when I first qualified, you talked about snapping the cord. Well, that is certainly not done anymore. But the idea is to try and clear that protein out of that collector and get the collector more mobile so that it can function and better and actually divert the fluid away from it. So compression and a compression garment in a situation like that, I would say, is absolutely essential to allow for that aggressive effect that the garment has to break down the adhesions that have formed within that collector. So why compression garments for lymphedema? Obviously, the elastic garment enhances the muscle pump. It acts as a counterforce against the tissues. It increases fluid uptake. It reduces the excessive institutional fluid. It gives the patient control. The patient is able to look after themselves. And it massages the superficial lymphatic system. And as I said, the flat knit garment is your gold standard. So now cancer, we know, changes lives. Okay, so in a study of 2019, they found that the upper limb lymphedema cancers, obviously we all know, were caused by surgical, the treatment, radiation, etc. But there's always a lot of thought about if you do the arm and move the arm too much post-surgical, you're actually going to create lymphedema. And that is not true. The study found that vigorous arm movements will certainly not cause an increase in lymphedema. And it's very important that that arm is moved. In 2020, they found that lymphedema affects 1 in 5 breast cancer patients. That's incredibly high. New techniques that I've been talking about, the fluoroscopy-guided lymphatic mapping and reverse lymphatic mapping, are now available to enhance the treatment techniques and enhance the actual fitting of the garment. So in other words, if we were going to fit a garment and we did lymphatic mapping, we could actually identify where the blockage is and therefore tell the person who's actually making the garment, if we're doing a custom-made garment, or if we're doing off-the-shelf, what type of garment will be most effective in this particular situation. There's a big study that went on in 2021 to show that the subsequent living with breast cancer-related lymphedema was far worse than the diagnosis of breast cancer itself. And it had a greater impact on the quality of life, both physically and psychologically. They also show that lower limb lymphedema is extremely common in post-gynecological malignancies. I've slipped in something here. Another little passion of mine is the lymphatic system, which we all know is the lymphatic system of the brain. And the latest studies are showing its incredibly high relationship to the development of Alzheimer's. So obviously we all know that lymphatic system we cannot compress, but we certainly can mobilize that lymphatic system, and with something that I decided just to slip in because I can. So we mustn't ever forget that lymphatic system. So the garments of choice are your Ulvarex or Varex, the jokes. It's a beautiful garment. Flat knit, as we were talking about the flat knit, it comes in various sizes, various types of garments, and various styles of garments. It is definitely the garment of choice. It can be, it's generally open toe, it can be closed toe, knee high, thigh high, and it is definitely, most definitely the garment of choice, both in lower leg and in upper and arms. Okay, so guys, thank you all for listening. Let's hope we can have a whole lot of questions. It was lovely talking to you. And over to you, Claire.
Thank you so much, Alison. That was really, really interesting and such an important topic. We have had a few questions. Let me get to the start. Is there any information available on the value of compression with fibroids, since they can lead to varicose veins?
I don't know what the latest studies are showing in terms of that, but compression within fibroids is generally considered a good thing to do. But I would have to get back to you and actually look up on the latest studies on that.
Okay. There's a comment by someone who mentions a medical scheme that has excluded all compression. How can we help our patients if the funders won't authorize it?
I would like to know from that. I haven't actually heard of that myself, and I'd like to know how common and how prevalent that actually is, because it's something I haven't actually dealt with myself. So that's a very worrying concept. I haven't heard that. Look, I think what we find is compression itself generally comes out to the day-to-day benefits. We no longer have the compression coming out of a certain fund of appliances. So if your day-to-day benefits are limited, your ability to put on a compression garment will be limited.
Okay.
And I'm going to be a little controversial here, and I will say that as physios, and as some lymphedema therapists, we aren't as successful as getting authorization for the fitting as garment as orthotists. And I think you need to find yourself a very nice orthotist, and there are so many out there, and I'm sure there are tons on here today, because they do have better way of getting around if you are hitting that problem,
Right.
to actually use your orthotist to get permission and get the patient adequately fitted.
Valid point. Do compression garments work for round ligament varicosities in pregnancy?
Yes, they definitely do. But remember what I was saying about, I was talking about putting compression over that area. You've got to be very careful with the type of compression. So you wouldn't put in a capri. You'd have to go into a full pantyhose so that you don't reverse the flow.
Okay. What advice would you give a diabetic compression of toes?
Oh, hard one. Right. I'll be honest with you. Obviously, we've got lots of toe caps out there that we can use. The most important, if you are going to put a toe cap on a patient, the patient must be able to see the end of the toe. It cannot be closed. So they must be able to visualize if there are any problems going in. But I find in a diabetic toes, I find bandaging with toe bandages far more effective, and the patient can remove them and have correct hygiene, and then be taught to put them on whenever they are required, and not actually use toe caps, and certainly not closed garments in a diabetic.
Okay. Can a patient wear a very light compression garment when she has chronic compartment syndrome due to sport activity?
Oh, I'm so glad that question came up. It is so important that these patients are in compression. Now, a compartment syndrome is obviously a build-up of fluid that causes that compartment to get tight. And I have so many patients that I do lymphatic mapping on that are actually caused by the compartment syndrome itself, that the lymphedema is caused by that. And it's caused from two reasons. One, often a surgical release of it, or second of all, the compression on the lymphatic collectors is actually restricted and then causing more inflammation. So the more the patient is in compression, and I would advise a class 2 compression for a patient like that, during exercise to prevent that buildup is actually really very successful when you are dealing with a compartment syndrome.
This came up quite early on in the presentation. Would you use class 1 or class 2 with deep vein thrombosis?
Definitely class 2.
Okay.
Okay, let's just talk about if the patient is sedentary, lying in bed, you wouldn't put on a class 2. I'm talking about a mobile patient who has a DVT. But if you're talking about a patient that is lying in bed, you would use an antithrombotic stocking. The moment that patient is up, you would convert them into a class 2 garment. Antithrombotic stocking is a stocking which is a very low amount of pressure that is only used for a sedentary case.
Great point. I don't see any other questions. Please just type them in the Q&A only box if I've missed. Hang on a sec, there's something come up in the Q&A only box. I wanted to say I love all the options that are available and all the aesthetically pleasing stockings. It's really been interesting. Can we utilize stockings for a patient with Kaposi sarcoma of lower limb? Which class?
Okay, yes, please, definitely. And I would definitely go for a flat knit garment in that case. And I would possibly, depending on the degree of the Kaposi sarcoma and the patient, I would actually go for quite high compression. A class 3 off-the-shelf flat knit garment, Jobst Alvarex, is your go-to garment for that. The Kaposi sarcoma is quite hard, and there's a lot of fibrotic tissue that comes into it. So to go in a round knit garment doesn't add the same degree of compression and the same degree of irritability that you want to get onto that softening of the fibrotic tissue. So a flat knit garment is definitely a garment of choice.
Wonderful. Is it safe for a patient to sleep with a class 2 arm compression sleeve?
No. A class arm compression sleeve is so basically a compression sleeve provides X amount of pressure. When the muscle is moving, it exerts X millimeters of mercury. When the muscle relaxes, it is still exerting X millimeters of mercury and therefore can result in a tourniquet. If you require the patient to be compressed at night, and most of them do, your best option is to put a night garment on, like a Jobst Relax or something in that terms, or even a wrap, a Faro wrap, so that you're actually able to have some form of compression, but it's not going to tourniquet at night.
Good to know. Okay, I'm not seeing any other questions at the moment. It's really been fascinating hearing your advice and all your knowledge and experience on this topic. So thank you so much. We always enjoy hosting you. Something's come up in the chat. Let me just see if that's a question. Okay, it's not. So thank you so much, Alison, for your excellent presentation tonight, and thank you to SCT and the people at Jobst for sponsoring this very interesting product talk tonight. We really appreciate it, and to our audience for joining. And there are still 135 of the audience members who have stayed with us for almost half an hour longer. So we really do appreciate that. And that just shows the interest in this topic. So thank you so much to everyone.
Thank you, everyone. It's been wonderful talking to you. And I see so many fantastic names that I know so well on this as well. But please, our door is always open. My door is particularly open if you need any advice. And please use your reps. They have fantastic advice to give you if you need any help.
Absolutely. Someone asked if a replay will be available. Yes, it will be, and it'll be emailed to everyone who registered for tonight an hour after the webinar ends. So that's excellent. Thanks again, Alison. Have a wonderful evening, and thanks again to our audience and to SCT. All the best, everyone. Good night.
Okay. Good night.